doctor today, and I'm supposed to be figuring out what's going on with you. You seem to be out of the zone. Why do you look so awful? Are you okay? Is everything all right?
Of course I am.
Okay.
Are you okay?
Yes, I am okay. So what brings you in here today?
I haven't had much sleep for the last couple of days. I've been really irritated. I cannot sleep. I can't. I've been trying for the last 2 days to sleep, but I can't.
Okay, you can't sleep?
Yeah?
Have you been taking anything,
No, the dog has been barking all night, and I can't sleep. I took him out. Actually, I want to leave him outside my house. I didn't want him to be inside my house. But what can I do? So I took him outside the house. We started walking for about a mile for him to stop barking. And he didn't stop barking. I came into the house, he stopped barking, and I still cannot go to sleep. Why am I here?
So, I thought you came in here to do an evaluation. It looks like you have a lot going on.
That's what they told me to come here for an evaluation. What is that? Why am I here?
Have you been taking any drugs or anything?
What? I'm sorry?
Pay attention. Have you been taking any drugs?
No.
No drugs?
No.
Are you sure?
Maybe? It's my sweet escape. I want to escape from all the problems that I have in my life. That's why I have to take cocaine.
Okay, so you say you've been taking cocaine,
Yeah.
right?
Mm-hmm.
So how often do you actually take the cocaine?
Whenever I feel irritated, whenever I feel I want to get high. Sometimes I just want to get high. Some of my friends told me to try the cocaine, so I'm enjoying it.
Okay, let me get this straight, sweetie. You've been taking cocaine, and you take it every time you want to get that sweet escape that you describe it as. This could be probably 2 or 3 times a day, based on how you're dressed. And
What's wrong with how I'm dressed? I'm the Egyptian queen here. What are you talking about?
okay, Egyptian queen, and you're
Can you
taking.
see how I'm dressed? That's really nice. Look, I'm matching my pants with my hair. This is my real hair. This is not a wig.
This looks nice.
Of course it is. What would you know? How would you know?
But you're thinking about, having these different moods, racing thoughts. Don't you think it's because of the cocaine?
Is it?
Yes, it's a stimulant. There's nothing wrong with you. Just get off.
What is a stimulant? What do you mean by stimulant?
It has you wired. That's why you're not sleeping. That's why you have all these thoughts. Get off the drugs. Check into rehab and just get off the drugs.
Can I do that?
You can.
Oh, nobody told me that before.
Just get off the drugs, okay?
Just get her off like that?
Just get it off just like that.
Didn't you just say something about rehab?
Just get off the drugs, okay? I'm sorry, I can't talk anymore. I have other people to tend to. I have other patients coming.
I paid you.
I'm so
I paid
sorry.
you to sit down with me and talk with me.
Yeah, I know, but I have to go now. I'm so
Excuse
sorry.
me!
I'm sorry. It's time for you
What
to
kind of a physician or a healthcare provider are you?
Yeah, it's time to go. Sorry.
Hey, they just told me to check into a rehab. I don't know. What do you think? Should I do it?
Hi, Rania. Thank you so much for coming to visit me here today.
Hi.
How are you?
Good. I'm okay.
You okay?
Mm-hmm.
Can you tell me how you're feeling, or?
Right now, I'm really upset because I don't have any money. I haven't been sleeping well, and I'm really broke. I spent all the money at the mall and I'm still broke. I'm still broke.
Oh, I'm sorry. I noticed that you came from the rehab facility not too long ago, right?
Yeah.
And how did that go?
That happened like 2 weeks ago, or maybe a month ago.
Okay. How long has it been since you've been feeling like this? Like lacking sleep and feeling like
Little over a month.
over a month?
Mm-hmm.
Okay. I have a questionnaire here that I would like for you to fill out for me.
Okay.
It would just ask you a couple of questions just to sort of clarify your symptoms, to kind of let me know where you stand.
Is it going to
as far
help
as
you
your
though?
symptoms. Well, this is going to help me. It's going to help me out to kind of determine where you stand. Do you mind filling it out for a few minutes?
No
It's just a couple of questions about how you feel, so it can help me determine where you stand at this point.
Okay, I'll do it.
All right.
Thank you.
That you just filled out and some of the symptoms that you're expressing to me today, I think that you may be presenting with what we call a manic episode. This is something that happens when a person is diagnosed with bipolar disorder.
Mm-hmm. What is that?
Manic episodes are not a disorder in and of itself. It's actually a type of bipolar disorder that is characterized by a period of at least 1 week in which the person may have elevated moods, or in here you also put that you also have racing thoughts as well.
Yeah, I felt that too.
You
That's
feel
right.
that it's potentially in about like a week or so?
Yeah, it was over like 2 weeks. Yeah.
So about symptoms like that, and the same as what you were expressing earlier, the elevated mood and also the racing thoughts and the feeling of grandiosity that sometimes you may feel, that can also affect, especially for a period of a week or so. That's what we call manic episodes.
That's what I'm having right now?
Yeah, potentially that's what we think that you may be having.
Maybe because of the cocaine?
Well, the fact that you were having some drug abuse problems in the past can also kind of affect the bipolar disorder as well, but you did a great job, and I want to appreciate the fact that you went ahead and you went to the rehab center. I think that was very brave of you. This is a very good step in your process.
Yeah, and I feel much better right now after coming out of the rehab.
Okay. As healthcare providers, sometimes it's a little bit hard for us to diagnose patients that have both conditions at the same time, because it's sort of the symptoms sometimes overlap a little bit. But right now, I'm thinking more towards you having this bipolar disorder. So we want to go ahead and prescribe you. I will go ahead and prescribe you medication for that. It's called lithium. It's 300 milligram capsules. What you're going to do is you're going to take 1 capsule 3 times a day.
Okay.
With this medication. Some of the possible side effects that you may experience are some diarrhea, nausea. I want to make sure though that you're not taking anything over the counter such as ibuprofen, because this can affect the levels of this medication, so I may have to adjust the medication accordingly. Also, if you're taking any caffeinated drinks like coffee.
Should I stop that?
No, maybe just don't take so much, because we want to, it can also affect the levels of this. But we want to follow up with you in about 2 weeks. Is this a good time for you?
Yeah, in 2 weeks, yeah, absolutely. I can come back.
So we're going to go ahead and follow up with you to make sure where your levels stand at that point, and then we can adjust the dose accordingly. But as of now, because this is my diagnosis, I think that I believe that you may have presenting with bipolar disorder, but I just want to let you know that I'm here to support you as well. If you ever need any kind of support or any support group, I can also provide you with information of any non-pharmacological treatments that you can use.
Okay, great.
All right.
Thank you
very
so much.
Maria.
Thank you. Bye.
Thank you.
Thank you.